articles and they're talking about the fetishization of the black body, barriers to effectiveness, disparities within women intersection. When there's a medical industry complex that sometimes has used and abused us, how do we figure out the difference between good and bad? So the first question people want to know is, why do we always push medication? Why is that something that's pushed? And I don't want to say pushed in a bad way, but that's something that seems like almost the first option sometimes.
I think it's very important for people to recognize that they can advocate for themselves, first of all. It's not the first thing necessarily, depending on what we're treating. Now, there's some things, there's no amount of therapy that's going to change. If someone has bipolar disorder,
Yeah.
fix that with therapy alone. It can be support, but it's not going to fix it. If they have schizophrenia or one of the other psychotic disorders, that's not going to be changed with just therapy. That needs medication. In some cases, actually, therapy can make that worse. So I think that it's not so much that it's actually pushed in most cases. I think it's that we have such an aversion and a fear as a community that any mention of it feels like a pushing. But there are people, and there are still health disparities, there are racial disparities because of systemic racism that makes some people just go to that first. It makes some people, some doctors and other providers pick more serious diagnoses that require those things when they're seeing the same symptoms present in someone who's Black versus someone else. So it's very important to make sure that you have a doctor that you feel like listens to you and that you advocate for yourself and ask the questions instead of, oftentimes people might go later and they ask their family or their friends or social media. But the time to ask is when you're right there because they're supposed to answer your questions, and that can help to get rid of a lot of that discomfort.